Assalamu alaikum viewers, I am Professor Dr. SMA Irfan, a colorectal surgeon. Today I am here to talk about successful laser treatment for failed fistula treatment. As you know, for a long time I have been treating all diseases of the colon and rectum, including piles, anal fissure, fistula, cancer, rectal prolapse, pilonidal sinus, and so on. And now I have made laser treatment my focal point. As a result, through laser, I have successfully treated various diseases of the colon and rectum, such as piles, anal fissure, fistula, pilonidal sinus. Among those who have performed the most successful treatments in the world, I am one of them by your grace. Today we will discuss the successful laser treatment of failed fistula operations. After operating on some high-level fistulas, that is complex fistulas, it is seen that the operation is not successful. That is the conventional treatment, the fistulotomy or fistulectomy, which involves cutting. So the patient went to the doctor performed the operation. After the operation, it was seen that his disease was not cured. That is, pus and water were coming out from the same place as before. Or after being well for a short time, it comes out again after a month or two. This is a very frustrating matter for both the doctor and the patient, because after this operation one has to sit in hot water for a long time, do dressings, etc. After doing all this, he got well, and then it was seen that the fistula had reappeared. Then if he goes to the doctor says, or has already said, that it can happen again, or it can happen repeatedly, or multiple operations may be required. So when he goes to the doctor, he says that he has to have another operation. After another operation, the patient asks again if he will be cured. Then the doctor says that there is no guarantee it can happen again even if he has another operation. This is a very frustrating matter for a patient, that it is not getting cured even after the operation. We have operated on many such patients who have had the normal conventional method of surgery and it has recurred. These patients have been treated and failed in Bangladesh, failed in India, failed in Singapore, failed in England. We have operated on many such patients again with successful laser treatment. The basic principle that we use, that is the laser application that we do, there is no cutting or any wound, just the fistulous tract. In a calculated way, we apply the laser to seal or close it. Along with this, it is usually seen that there are other diseases. The patients who fail, they have other diseases. Sometimes the anal passage is narrow, there is anal stenosis. These diseases are often not diagnosed. As a result of not being diagnosed, the failure rate is higher. We definitely diagnose these diseases as well, and their treatment is also done at the same time through laser. Even if there is anal stenosis, we also do that with laser. That is, there is no cutting there either. In other words, if a patient needs more than one operation, that is, needs an operation for more than one disease, we perform all those operations at once through laser without any cutting. And here I have operated on as many patients with failed fistula treatment as I have. Alhamdulillah, all the patients, 100% of the patients have recovered. Among these patients, there are foreign patients, that is, those residing abroad in Singapore, Malaysia, Japan, England, and of course in Bangladesh. All the patients have recovered and they have gone to their respective fields and are doing their work, jobs and everything. So we are treating all the failed fistula patients without any cutting. Those of you who are suffering from this disease, or your relatives or acquaintances who have failed, if they come to us, I can definitely say that you will get successful treatment. Thank you all.